Hi, my name is Kirsten Kimura. Welcome to the Balanced Vibes podcast. If you're ready to quit the black and white approach to health and fitness, this is the podcast for you. There's no room for extremes and all or nothing thinking. We are here to talk about real health, sustainable diet and fitness, positive psychology, and spiritual growth, helping you become your own biggest superfan. Welcome to the show. Before we get started, remember that I am not a doctor, and the content in this material is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your health. Hello, everybody. Welcome back to the next episode of the Balanced Vibes podcast. I am your host, Kirsten, and today I am joined by Dr. Elly Michelle Lieppman. Hey, Dr. Elly, how are you doing?
Hi, I'm doing wonderfully. Thank you.
Awesome. So Dr. Elly is a naturopathic doctor, and her areas of expertise, among many other things, are hormones, GI health, recovering from disordered eating habits, and so on. Is that right?
Yes, that's exactly it.
Okay. So why don't you tell us a little bit more about yourself? What are you doing, and how did you start doing what you're doing right now?
Yeah, sure. So in case there are any listeners who aren't familiar with what a naturopathic doctor is, we're licensed primary care doctors. We have a focus on identifying the underlying cause. So the philosophy is really one of the primary distinguishing factors that sets us apart from a conventionally trained medical doctor, where the focus is just on treating the symptom. And often they will prescribe pharmaceuticals or recommend surgeries for things like that. Whereas a naturopathic doctor, some people say naturopathic, I might use both. I switch around. A naturopathic doctor or naturopathic doctor will, their priority is to figure out the root cause of why that's happening and address that root cause so that it's a more sustainable, long-lasting result instead of just masking the symptom. So that is my philosophy as a doctor my approach to medicine. And then the other big distinguishing factor is the way that we address the types of treatments that we use. So we're going to be much more focused on lifestyle, nutrition, and then we will use things like vitamin, mineral supplements, and herbs as well. So we have a lot of different tools that we use, and it's always going to be much more of a holistic approach when we're addressing people's concerns. So there's that. How I came into this, it's complex, but it's very much, it always comes back to my personal experience with an eating disorder, which I know we're going to talk about pretty soon, probably. But so I had an eating disorder, specifically anorexia. I developed that around age 15. And that was really kind of my gateway into the world of healing and alternative medicine, because I had a firsthand experience of kind of going through the conventional system and seeing how they addressed me and how they dealt with me and what their approach was to what I was experiencing. And it always just feeling so not right. And I was always like, why are you wanting to put me on birth control because my period went away? And why are you wanting me to take anti-anxiety and antidepressant medication? Like, why are we not actually asking the real question about what's really happening for me and why am I dealing with life in this way? And so, at that age, even at the time, even though I was struggling, I had this deep knowing that this just did not feel right to me and it was not resonating for me. So eventually, once my eating disorder had stabilized, and I was in college and I was starting to think about what I wanted to do for a career and what I wanted to study. And because of everything that I'd been through, I was just fascinated by the body and by nutrition. And I also knew how much movement had actually been a big part of my recovery. Doing things like yoga and actually dance was really big for me as well. So because they brought me into my body, they got me kind of out of that head of when you're in an eating disorder, you're very much in your head. You're not in your body. You're not in tune with your body at all.
Sure.
And so it really got me back into my body and taught me how important it is to fuel my body if I want to be able to do these forms of movement that brought me so much joy. I had to give myself fuel to do them. So we'll talk about that later, I'm sure more. But so I was fascinated by movement, and it just really opened up this whole world of health and all the different ways that the things that we can do to support our health. So that whole experience brought me into this journey of loving the body and health and how we can optimize that. And when I found out what naturopathic medicine was, or when I didn't even know that it was really a thing for a long time, but once that opened up, I just knew that this was it. This was exactly what I was supposed to do. And I felt this big calling. And I've never looked back. I just went all in on becoming an ND. I didn't necessarily always know that I was going to have a focus on eating disorders and hormones and things like that. I didn't really predict that, but of course, given my experience, that is natural. It was just a natural fit.
Yeah, this is how it often goes, right?
Yeah.
We have been through something, and then we want to help others with the same thing.
Yeah, well, and also there's not a lot of NDs that focus on disordered eating or who have the experience that I have. So it's definitely kind of there's a gap, I think, that I'm hoping to fill more and more, the more experience that I get. Because I feel that disordered eating or any kind of restrictive eating is a root cause of so many hormonal issues, and so many women are experiencing hormonal concerns, like whether it's no period or whether it's PMS. There's so many different symptoms that we have as women that are always tied in with our hormones, but the majority of women have some kind of body struggles as well. And so I think that that's no coincidence. Anyway, it's just a huge passion that I have of the way that we take care of ourselves, and then what our hormones are doing.
Yes,
it's so individual.
Yeah, and like you said, a lot of times conventional doctors are just prescribing the next pill, whether it's birth control pill or depression medication, whereas actually the problem might be a hormonal issue, which could be corrected by fixing your lifestyle. 100%. Right, eating differently, moving differently. I think it was. Do you know who is Nicole Jardim?
Yeah,
of course. So she even said in one of her programs that I don't remember the exact numbers, but she said that basically a lot of times when women are prescribed depression medication, the problem is just hormonal imbalance, and we would not necessarily have to take these pills, to fix it where, there's
and then we would also probably want to ask, well, are they on the birth control pill as well?
Yeah, if that's the cause, right?
Yeah, very much so, because very often people will have more depression or anxiety once they're on the pill. So there's we don't know enough. We don't have enough information to really understand how the birth control pill is affecting us on not just our hormones, but on a mental health level, on a digestive health level, our inflammation. There's so much still that's like, we really don't know about how that impacts us. Yeah,
absolutely. So why don't you tell us a little bit more about your patients, those who have any disordered eating habits or eating disorders? What kind of issues do you see the most?
Mostly HA. Mostly HA for sure, which I know you're very familiar with as well. Definitely, I see that a lot. I do also see some women have much more PMS type symptoms, but they have very similar history of becoming very focused on their body and what they eat, and or they sometimes often will have a lot of digestive concerns as well, and that's their primary reason for coming to see me. And because they have so many digestive concerns, they've ended up having to become extremely selective, or they become very obsessive about food because of how it's going to make them feel. And so that's always kind of a tricky one too, because I'm like, oh, it's a chicken or the egg kind of situation. Exactly. Did the disordered eating kind of trigger their digestive issues, or did the digestive issues trigger the disordered eating? But I do see that quite often. And then sometimes, that's what I was going to say. Sometimes they also will have, a lot of just bloating or cramping or mood symptoms that are associated with their periods. But there's still a lot of restriction there. So they're having cycles, but they're still having the kind of obsession around the food focus and the body focus. So it affects people differently. It doesn't always look the same.
Yeah.
But the more clinical experience I get, I see that it always just it's always a lack of feeling safe, I think. And some people the period's going to go away. Sometimes the period's going to just go really crazy and they're going to have all these symptoms. So yeah, like I said, not everyone's going to respond the exact same way, but it always comes down to if we are becoming obsessive about controlling our body and food, the hormones are going to respond however they respond.
Mm-hmm. Yes. Just before we started this interview, actually, I watched one of your recent stories on Instagram, and you were talking about feeling safe and feeling unsafe, and our hormones respond to how we're feeling. So would you tell a little bit more about that?
Yeah. So a lot of this is back to the stress response. And so we know, the big thing with HA is the body is under so much stress that it feels that it's not safe to have a pregnancy. And so it shuts off our reproductive system. And that is very often, it all comes back to cortisol, which is our primary stress hormone. There's other stress hormones as well, but cortisol is the big one. And we often don't think about how, we think about like, okay, our stress from work, or with HA, we think about stress from overtraining or stress from underfueling, emotional stress from, relationships or financial concerns. There's all these different external things that we think about that are stressors, but we don't think about the internal environment because we're living in that constantly, 24/7. There's no escape from what's in here and, what we're saying to ourselves all the time. And so if we're constantly like beating ourselves up or talking down to ourselves, or we have very negative dialogue internally, that's a big stressor. Because like, imagine if you were living with, when we're young, if we're living with a parent who's constantly like, saying mean things, like who's emotionally abusive, that's going to be a big stressor for a child to grow up in that all the time. And so we basically are doing that to ourselves as women. And so many women have that people-pleasing complex.
Oh yeah, tell me about that.
So like, it's so and that, yeah, it's a big thing. I feel like so many of us have that. And so that, again, it's like if we have the people-pleasing context that you're complex, you're being hard on yourself constantly. You're constantly putting yourself under a lot of stress and pressure. And so your cortisol is going to be affected by that.
So how do you start working with somebody? Where do you even start? Because of course, yes, we know that food and fitness is one thing, but the internal stuff that's going on is another thing. Of course, they're related, but how do you get started with just like, healing the whole big thing?
Yeah, it depends so much on the person and where they're at. One of the I really feel like there's a lot of art in what I do. It's a lot of intuition and just kind of feeling out, what is this person available for? What are they going to be receptive to? Some people really just need to focus on like food and having some structure in their eating for a while, just to kind of get grounded, because if they're not eating very much, they're not going to be able to do the emotional work. You probably understand that a lot with your clients too. When you're under fueled, you're just like, you just can't handle emotions as well. Yeah. You're not ready to really dive into that. And so sometimes I just have to start with just getting them eating regular meals, getting them to eat more. But it's so intertwined with the emotional aspect, and their inner dialogue is going to prevent them from being able to do that too. So we kind of have to do it all a little bit at a time.
Yeah.
But yeah, I always, when I'm working with people, probably pretty early on, I'm always telling women, okay, you got to eat more. Like I say that all the time.
Yes.
And some people are really good. They're like, it's kind of like a relief. They're like, okay, finally, like they just needed to hear that it was okay.
Yeah.
Because everywhere else in culture, they're telling you to eat less.
Yes. Yeah.
And so that pretty much happens always. And I mean, all my patients here, pretty much within the first or second session, more protein. Most of them are not, very much under eating protein. Mm-hmm. So yeah, I very much often start there.
You see, I see a lot of women, I would say maybe like 75% of women who have this issue have been on a very, very low carbohydrate diet. Do you see that as well?
Yeah, I actually don't see that as much as you would think. Definitely in people who have, who are very open about their history with disordered eating, they definitely will say, oh yeah, I'm afraid of carbs. I have a lot more of my people with HA definitely have been low carb.
Yeah.
Seems to be for a long time. Yeah, for sure. But other people, no. I mean, just the patient that I just had earlier today, I mean, she's pretty much lived only carbs, hardly any protein, but very strong eating disorder history. So it's hard. I mean, everyone has different like food rules.
Yeah. That
they've been living with.
Yes. I would actually really like to continue with food and ask you a couple of questions.
Yeah.
So how do you feel? So I just interviewed two women. Both of them had hypothalamic amenorrhea. They were both on the podcast. And one of them took the super quick approach where she started eating like absolutely everything she wanted, all the things you could imagine, because she was, first of all, she was really hungry and deprived, and that's what she really wanted, but she also wanted to get her period quickly. And then there was another woman for whom she said, it was so hard for my psyche to jump right in and start eating like tons of food and everything. So she was the very strategic about how she did it. She figured out her maintenance calories. She upped her protein. She continued training, and it took her a year. Whereas for the first woman, it took 6 weeks. 6 weeks. So do you see that there are different approaches that work for different people, and you go from there? Or do you have like, okay, there's one way and this is how we do it? How do you do that?
No, definitely the first option. My approach, again, I should have said this in the very beginning too, as an ND, everything is individualized. So I don't really ever do protocols. I create an individual protocol for each patient or client that I work with. So yeah, when it comes to food and healing from HA, definitely I go with what feels right for them. I mean, no matter what, they're going to have to eat more. That's the part that's non-negotiable. Yes. But how much more and what that looks like is really, really unique to them. I also will have some people, actually, I very rarely have seen people who actually want to go all in. A lot of people actually find me, and they've found the No Period Now What book of that. Dr. Rinaldi coined that term, all in. A lot of people don't want to do that right away. I mean, I know when I was going through HA myself, I didn't want to do that right away either. It's really hard. But I definitely will give them a framework. So I'll give guidelines for like, okay, we want to have 3 meals a day, at least, with snacks. Yes. And it should contain, all of the macronutrients and vegetables. But definitely we want the focus to be the macronutrients, because a lot of times people, they're like, have no problem eating all the vegetables in the world, but they're not getting enough actual calories from the macronutrients. So I tell them to kind of, eat your vegetables, of course, but that should be that the focus is the macronutrients for sure. Exactly. So I think having a framework is really important, because as you know, a lot of people are not very in tune with their hunger and fullness cues. Absolutely. When there is a history of disordered eating and restrictive eating, because we're really disconnected from that. So we kind of need some structure.
Yeah, I agree. I really like this. That's how I do it too. Let's have 3 meals and try to keep them roughly the same size, so that you don't have like 100 calories for breakfast and 100 for lunch and then 7 million at dinner. But like try to make them more equal, and then have some snacks, so that your body starts recognizing some patterns. and also knowing what's next. Because if you've done like a lot of fasting or things like that, your body's confused all the time. It doesn't know, it doesn't have any safety, which brings us back to what you said, your body wants to feel safe.
Your body wants to feel safe. Exactly. It wants to know that nourishment is coming.
Yes.
Yeah.
What about food quality versus quantity? How do you address that with your HA clients?
Quality versus quantity. I mean, I personally, I feel that both are important. Mm-hmm. I don't think that one is, I mean, when it comes to HA, quantity, of course, is important. We need more. And I mean, I would argue that the majority of the women that I see, at least, need more. Even if they are cycling, and if they're because people come to me often and they're having periods, their concern is not to get their period back. Mm-hmm. But they'll have other concerns, and I'll do their labs and I'll still see your labs are telling me that you need to eat more. And that's another answer when you asked me earlier about what's kind of the first thing that I do. And I was talking about, everyone hears to eat more, but also I run labs. So because I'm a doctor, I can order lab work. And when I look at lab work, often that is a lot of motivation for people. So if people are kind of not quite ready to eat more, when we do their labs and we look at their hormones and we look at their thyroid, thyroid governs your metabolism. Most people know that when you start decreasing your food, your metabolism is going to match that and it's going to slow down. So your thyroid tells me a lot about that. But also your lipid levels, so your cholesterol levels tell me about how well fueled you are. Your blood sugar regulation markers tell me about how well fueled you are. Your sex hormones, of course. And then nutrient levels too. If you're under eating, your nutrients are going to be low. Mm-hmm. So there's a lot of different things that I can kind of pick up with lab work that give me the full picture. But that's also really helpful to use. So for people, even if they are having a period, there's still other things that I can see. Mm-hmm.
Definitely.
On that.
Do you mostly use the Dutch test, or what do you use?
No, well, I do use the Dutch test in certain situations, but not when people, not if they're not having their period. The Dutch test, I mean, it's not gonna, I know what it's gonna look like. But I do, I use a lab company called Vibrant America, but it's just blood work. So I'll make sure that people have, they usually will have a mobile phlebotomist come to them and draw their blood, and then it gets processed at the lab, and then I get the results so I can interpret them.
Mm-hmm. Okay.
Yeah.
So what about food quality? I want to go back.
Oh yeah. I'm sorry. I got sidetracked. Quality. I mean, yeah, I think that is really important. Again, as an ND, I feel very strongly that lifestyle and nutrition are one of the most important. They're the most important aspects for creating our health foundations. And so part of that means having food that is low in toxins, low in pesticides and things, because that will also have a different kind of harmful impact on our hormones. So, and for women who do have healthy levels of hormones, it can basically prevent us from being able to process those hormones well and have good hormone metabolism. Because it's more for our liver to process. If we're getting exposures to all these other things in our food. So that's why organic is so important, because if we're not eating organic, then we're getting exposed to pesticides and herbicides and glyphosate, which are extremely harmful for us. I think organic is really important. I mean, people who follow me know that I'm definitely a proponent of animal protein, so eating meat. So I think that if meat is something that you're consuming on a frequent, daily basis, then we definitely want to make sure that we're eating animals that were healthy and the animals that were pastured and grass-fed, and they weren't fed a bunch of GMO soy and corn, So yeah, quality I think is very important for us to have overall health.
Yeah, I totally agree with you. And, this is the place where sometimes people can go like, hey, you're just like promoting, like food obsessions or unhealthy obsessive behaviors if you're so preoccupied with, how clean the food is. But I think it really does matter. Like our food environment, it is pretty crazy. And so,
Yeah.
it's been shown many times how they can mess with your hormones and not make you feel good. So I don't think it's completely fair to say that, it's okay to not pay attention to, the quality of your food. It really does matter.
I think it really does matter. And I think that's a really interesting point that you brought up. I mean, that being overly obsessive with the quality and trying to be perfectly healthy all the time, that is they say that's a type of eating disorder as well, orthorexia. And I think that is a really real thing, because it can really interfere with your ability to really just enjoy life and be present. You can become very preoccupied with that to the point where it disrupts, you can't go out and do social things. And oh, that is such a tough subject. And I get it, because the more aware you are of all the harmful things in our food system, the more scary it can be to eat. It takes some of the enjoyment away, because you're like, oh, I don't want to, harm my body. So I really get that. But then also, coming from a background of disordered eating, I get that you want to be able to relax more around those things too. So I think that for everyone, we have to find our own balance of what that looks like, of where we're doing the best that we can to support our health, but it doesn't have to also get in the way of you just being able to be present in your life. So for me, like, what that looks like is when I'm at home in my routine, whenever I'm in control of what I'm eating, I do the best that I can to, given whatever within my financial means. I do spend more money on organic and good quality meat, etc., because it's really important to me. But if I'm out in different situations socially, I'm not going to not eat at a place because they didn't have grass-fed meat. You know what I mean?
Exactly.
Like, I'm going to just eat it and be like, okay, like, this is my, you just always have to make the healthiest option that you can. And often when you're at home and you're the one preparing the food, you can make a really healthy option. But when you're out, you just make the healthiest choice that you can, and then you just enjoy it and move on. And you know that as soon as you can, you're going to get back to your own routine. So I don't think that it's something that we need to, I'm not going to starve myself if my only option is something that's not organic.
Yeah, no, I absolutely agree. There has to be a common sense too.
Yeah.
Yes, do your best most of the time, what you can.
Right.
There are so many choices, so many times where we can make a better choice.
Right. But in the past, I probably would have had experiences where, like, if I went out and my only option was something that wasn't organic or wasn't grass-fed or whatever, I would have either just not eaten, or I would have been extremely stressed out. Like, I would have felt so much guilt.
Yeah.
So that's what I'm talking about, is like, can we go out and be able to just eat it and then move on and not get all ruminating in our head about it, or not feel like we have to starve ourselves instead of eat it.
Yeah, exactly. It's like a big spectrum, and you want to be somewhere in the middle. And even in the middle, it's pretty broad, where you are. It doesn't have to be like this like crazy dieter who like eats only at home or brings her own like Tupperware everywhere. It doesn't have to look like this, but it also doesn't have to look like, eat absolutely whatever you want, and don't ever think about, what you're putting into your body, because this is the food freedom. It is actually not. So the truth is, it is really somewhere in between, and we gotta just make, like you said, the best choices that we can.
Yeah. And for women who have struggled a lot with eating disorders and disordered eating, it can be so hard to find that balance where you can make different choices, make choices about what you're eating really truly based on what makes you feel good. But that's what I think real healing comes down to, is like, you can trust yourself to make the choice that's going to serve you the most. And sometimes that's going to mean eating like the treat or something, but other times it's going to mean not eating it, because that it will make your blood sugar crash, or it's going to give you brain fog, or it's going to make you constipated. I just want to feel my best. And that doesn't mean that that doesn't mean restricting food. It doesn't mean starving myself, obviously, but sometimes I do. And sometimes I will eat sweets because in that moment it's like, no, this is going to be nourishing for me. But other times it's not going to be nourishing, but we get to give ourselves that freedom make to know ourselves and know our body and know what is going to be best for us in that moment.
Yeah. And also sometimes just be aware of the consequence. Sometimes you do know that it's not going to feel great, but maybe I just wanted it. Like I like to drink wine. It doesn't always make me like feel wonderful, but I still want it sometimes, let's have it once a week or so. There's always, you gotta like know there's a trade-off problem. Right. Yeah.
Absolutely.
Yeah. Okay, let's talk about red meat. You love red meat?
Why is it so good? I love red meat. So,
and you even like organ meats.
That's great. I do. Yes, that's been something I like more and more as well. So red meat, I think, is one of the most nourishing foods for women. It is the most bioavailable source of B vitamins and minerals and iron, which are, women very commonly are deficient in those. That's some of the most common nutrient deficiencies that I see: iron, B vitamins, minerals as well. So, and then of course, if we're cycling, we're losing blood every month on a regular basis. So it's really important to replete that. Also because of the protein. And again, women are very commonly not eating enough protein. And so increasing that animal protein is really important for maintaining our muscle mass, for hormone health, for our hair, skin, and nails. I think meat is, I don't like to say anti-aging because I'm not anti-aging. We're going to age. It's going to happen. And I think we can age gracefully and beautifully. But it's really important. Meat and protein consumption is really important for aging well, because it helps us, maintaining our muscle mass. And the minerals are important for skin health. Collagen, of course, very important. So yeah, I think that it does so many wonderful things for us. And it's important for our energy, our sex drive, focus.
Yeah. You mentioned B vitamins. I believe that there's been studies that show that those who are low in B vitamins experience much more depression, anxiety, brain fog, that kind of stuff. So, I would, I think it's a really good idea if you don't have these, you don't eat red meat regularly, add some more. I'm not too sure where this thought is coming from, that red meat is only for men, or it's such a dude thing, or it's not. Totally. Let's just eat that red meat. It's fine.
Well, that's it's a product of cultural conditioning. Because I think, there were, I don't know the exact dates, but there have been studies in probably the 80s and the 90s that basically associated red meat with cancer, different types of cancer and heart disease. And so it's gotten a bad rap, and we've pretty much debunked that. We now know that that's not true, but it's still, it's so ingrained in us that red meat is something that we need to minimize.
Yeah. Just like fats too, right? Let's not eat butter, it's bad for you. No, how about no, it's not like that.
Right. That took me even a really long time to get over. I had the whole idea that butter was bad for a long time too. Now I love it. Thank goodness. It's so good. But yeah, so I think a lot of us just still have that leftover programming that we shouldn't be eating a lot of red meat, and I personally feel that that's a reason why women's health has suffered so much, and women now have so many health concerns, whether it's autoimmunity or hormone imbalances or even more concerning issues. So
very good point. I haven't thought about it this way, but it makes total sense, because I feel like
our body needs nutrients to function optimally, and that's such a great source of nutrients that we're missing out on.
Yeah. Red meat, egg yolks, eat egg yolks too, people. Want to avoid all these old messages that we still have in our heads, that you only have egg white omelets and a little bit of, I don't know, chicken breast.
I know. When I still hear people that are doing egg whites only, I'm like, people are still doing that?
Yeah.
I can't believe we're still just eating egg whites.
Yeah. I sometimes add them to my omelets to just up the protein a little bit, but there's always yolks. It's never egg whites, never. And then organ meats.
Yes. Organ meats as well. It's the same reason that I like red meat. It's extremely nutrient dense. There's a lot more variety of nutrients in the organ meats than you're getting even from red meat. So I think just having both regularly. And the thing with organ meats is that you don't need to have that much of it. You don't need to have like a giant portion. They're pretty strong because they're so nutrient dense. The taste is so strong. I mean, things like liver, because of the iron content, that's why most people, not most people, I shouldn't say that, but a lot of people don't enjoy the taste of liver because it's so strong. That's because of the iron content.
Yeah.
So you don't have to eat like a giant amount of it.
Yeah.
You can just have a little bit, like just have a few bites.
Yeah. Or you can mix it into your, patties, like ground beef or whatever. Just like a little bit.
Yeah. Absolutely.
Yeah. Okay. So what about movement? So you mentioned, we talked about protein and we talked about meat and you said it's really important for maintaining muscle mass. So why is muscle mass important and how do you personally maintain or even increase your muscle mass?
Yeah. So muscle is really important. So one of the biggest things that helped me actually improve my health after having an eating disorder for the time that I had was building muscle. So even once I had restricted, or once I was recovered from my eating disorder, I still was at a pretty low body weight. So even though I wasn't actively trying to restrict food and I wasn't actively trying to lose weight anymore, I was still just kind of out of habit under eating, because when you come from that background, it's really hard to keep increasing your food. So I still was very thin, and I was also vegetarian at the time. This was about the time that I started medical school, and then I started getting my medical training, and I was learning about all the body systems and learning about physiology. And I think it was when we were learning about the skeletal system and bone, and I really started to realize how much not having a period and having low hormones was dangerous for my bone health. And so I started getting very concerned about that. I was 23 at the time, and I was researching it and learning about it, and I kept seeing, okay, weight-bearing exercise, strength training, putting that weight bearing on your bones, on your skeleton, is really important building muscle mass is important for bone health. And so I was like, well, I need to start strength training then for my bones. And so I started doing that primarily for bone health. That was my primary motivating factor for strength training. So strength training for women that's one of the biggest reasons why I'm such a proponent of it, is for bone health. Again, for longevity. So do you know Dr. Gabrielle Lyon? Do you follow her? Okay. She's a great person to follow. I mean, she's very big on muscle mass. She coined the term muscle-centric medicine. So she's all about muscle as the organ of longevity. So I really like her content a lot. So she talks a lot about how muscle is the organ of longevity. So a lot of people don't realize that muscle actually is an organ in itself. And in order to have longevity, we need to know that we have a lot of muscle mass. So that's another reason why I think that strength training is so important, and muscle is so important, is just for our longevity as women, so that we can live long and healthy, and also for metabolic health, healthy blood sugar metabolism, being strong. That's another reason why we want to have muscle masses. So as we get older, we can just continue to have strength, and we aren't going to be as susceptible to falls and frailty, which is that's probably why people with age, they are more susceptible to different illnesses, is because they are not able to, they're more susceptible to falls because of fragility. So that is preventative of that.
Yes, definitely. And just like overall being able to function in your everyday life, your independency as we age, there are so many benefits. And also hormonally, strength training is actually superior. Like if you compare like strength or the traditional cardio, which is like 1 hour run, for example, can you tell us like how these two types of trainings can have different impact on your hormones?
Yes. Yeah, definitely. because the running is going to be more, it's going to push the cortisol pathway much more.
Yeah.
So it's going to be much more stressful, and you're not actually building any muscle.
Yeah.
You're just expending energy. So it doesn't, a lot of people run wanting to look more fit, but you're not, it's the muscle that's actually going to make you look more fit. So anyway, I don't like to go too into the aesthetic portion of it, but it's kind of counterproductive.
Yes.
So for people who are really hardcore runners and they get that runner's high and they love it, I'm like, okay, great, good for you. You're getting outside, you're getting fresh air.
Yeah.
That's great. I get that, but it's not going to give you, it's not going to really change your physiology in the way that strength training will, because it really affects, you know, you're building that muscle, you're optimizing hormonal health, and it's so much more important for longevity, or it's more beneficial for longevity than something like running will be.
Yeah. And I think it's important to understand like how the running or other long cardio training, it's catabolic in nature, right? Catabolic means that we're breaking down, but we're not only breaking down the fat tissue, which is what a lot of people want. We're also breaking down the muscle tissue. So there we are, losing weight, yes, but do we actually want to lose muscle? No. And this is what I did when I was, between like 21 to 27. That's all I did. I was running. I was really, really thin. Yes, but I had like no muscle in the body, and that started growing only later when I started to do more strength training. So strength training is anabolic, which means it builds up your muscle again, and this is what it's really important to kind of the difference.
And it builds self-confidence too. I mean, that's again, I think one of the reasons why it was so healing for me when I was still thin, to then start strength training and to see the way my body started transforming. But and I was I was putting on muscle, I was growing, but I felt strong, and I was like, oh wow, like I'm actually strong. And it really it strengthened my relationship with myself. And I started feeling way less body insecurity because I'm building confidence on a deeper level.
Mm-hmm. Absolutely. Yes. Actually, a couple of years ago, I worked with somebody, which is going to be an example of how strength training can really improve your confidence. I started working with somebody at the gym. She was quite an obese person. And then she said that she had never thought that she has anything to do with the gym or any like physical exercise, because she had only thought that, okay, like I have to get on the cardio machine, I have to run, and it's too hard for me. And I feel very, very self-conscious because she was, larger woman. And then we started doing traditional powerlifting, which is, 3 lifts. You got your bench press, you got your squat, you got your deadlift. And then she was like, oh my goodness, like I just feel my confidence has skyrocketed and I belong to the gym. I was like, this is awesome. Like this is what we want, it can really boost your confidence. There's something about lifting, picking up heavy stuff from the floor and putting back down. It can be very, very empowering. And
it really is.
Yeah. And if that brings people to the gym and starts healthy habits for them, I think it's absolutely amazing.
Yeah. Yeah. I mean, strength training absolutely was life-changing for me. So I'm a huge, huge proponent of it.
How long have you been strength training regularly?
Well, I started kind of my journey when I was 24. But I started when I was 24. So I mean, I guess giving away my age, but 6 years.
Yeah. Okay, so let's talk a little bit more about like general lifestyle too. We covered the food and then the fitness. And one of the big things that I feel like a lot of people don't really pay attention to is sleep. Tell us more about sleep and why it matters.
Oh my gosh, sleep matters so much. I think sleep used to be probably like number 3. I'd be like, okay, nutrition is probably number 1, then exercise, then sleep. Now sleep is my number 1, for sure. That's my top priority. So I will be honest, I'm not like someone who's living in the research all the time and has all this data and like can cite all these studies. That's not who I am. There's lots of people out there who are like that, but sleep has everything to do with our hormonal health. If you're not sleeping, you're not going to have balanced hormones. There's just no way. So again, I'm all about the foundations. Sleep is one of our health foundations. If that's not in place, nothing else really will be. So if you're having any kind of symptom, you always have to go back to the foundations. And if the sleep is not there, Nothing else that you do. I mean, anything else that you do is going to be like putting a Band-Aid on. You have to dial in your sleep. So it's important for, like I said, hormonal health. It is the number one anti-inflammatory. So it's important for keeping inflammation down. People who are not sleeping are going to be more inflamed. It is super important for brain function, of course. And it is important for immune function as well. It lowers stress. I mean, there's a million things that it does.
What would you say is the optimal, 7 to 9 hours? That's what you would say?
Yeah, I would say 7 to 9 hours. Yeah, somewhere in there. 8 hours, ideally, but everybody's a little bit different. Some people can do fine with 7.
Yeah.
Some people need more. I think probably for a lot of women who are recovering from HA or who are, haven't had their period for a long time, they're definitely going to want more than that. I mean, I know when I was going through it, I felt like I needed like 10 hours of sleep a night.
Yeah,
so if you can get more than 8 hours, and if you feel like you want more than 8 hours, do it.
Yeah.
Because your body needs it.
Right. What would you say, or how would you start? How would you help somebody who just does not sleep? Just, either you wake up at night a lot, or you just are not able to fall asleep. They want to, but it's just not happening.
Yeah. Again, it depends so much on the individual. I think that the first thing I would probably look at is their sleep hygiene. So what they're doing in the time sort of while they're preparing for sleep. So in the couple hours before they would go to bed, what are they doing? Are they on their computer with the blue light for a really long time? Or maybe even if they're on their computer all day long. So I would look at kind of how much blue light exposure do they have? What's their sleep environment like? Are they sleeping in a totally pitch black room, or is there a lot of light kind of coming in somehow? So either getting blackout curtains or like a sleep mask. Anything that could be disrupting their sleep, like if they have a pet or someone snoring, there are other things. So I really just evaluate the environment. And some people, again, everyone's so individual, but some people need to really make sure that they allow enough time after dinner to digest, because if they're eating too close to bed, then their body is more focused on digesting their food as opposed to the rest and restorative processes that can happen during sleep. But other people really need to have a snack, soon before bed to help them sleep more soundly. So the blood sugar thing is something to keep in mind for sure.
Yeah.
Watching TV before bed, not very helpful for good sleep. And then, so we look at that. A lot of times I will use calming nutrients. So for people who have that, like, their brain won't shut off. They're just laying there and their brain's just going and going and going, or they're waking up in the night and that happens. I'll use some combination of like a formula that's more calming, like with magnesium, with glycine, with taurine, which are amino acids. But again, it depends on the person and kind of what I'll utilize with them, or we'll usually experiment a little bit and see what they respond well to. So yeah, there's definitely supplements that we can use to support that. And I mean, it is a Band-Aid essentially when you're giving somebody supplements to help them with sleep. But when they're natural things like magnesium that the body needs anyway, then I feel like that is still supportive of their overall health.
True.
Yeah.
And when we started this podcast, we talked about like the internal stress and like feeling bad about yourself and being super hard on yourself. I have a feeling that can affect your sleep as well.
100%. Yeah, 100%. You have to look at what are their stressors. Those are usually the hardest things to change, though. A lot of times one of their main stressors is like their job, but that's not something I can easily tell them, we'll just go get a different job, and we'll talk about it usually. And I have had several patients who do end up, either, taking a leave of absence from their job to try to figure things out, or they do end up quitting. So sometimes that does happen, but often, that's not something that's really easy to just change right away. It takes some time. So yeah, the actual life stress, that's the more challenging thing. If that's actually the cause. But if I do feel that that's the root cause of why someone isn't sleeping, I will say so. I don't really sugarcoat things.
Yeah. Would checking the cortisol levels be helpful for that?
Yeah. So in my patients who really do have issues with insomnia, I will actually often do a Dutch test with them. And there's one test, I think it's a Dutch Plus, that you also, so not only are you testing your urinary metabolites, but you're also doing saliva. So you're doing salivary cortisol. And so you get the urinary plus salivary levels. And that can help us to get a better idea of what's happening or what their cortisol is doing. And if it's spiking and that's why they're waking up. So we look at their cortisol throughout the day and what's happening when they're waking up at night. And that can help us to get a better understanding of how cortisol and their sleep are connected. But then we just have to figure out, okay, well, what's the reason why is your cortisol behaving in this way?
Yeah.
Which again goes back to stressors.
It does. Everything
and blood sugar.
And blood sugar. Yes, this is the big one.
Yeah.
This is a really, really big thing. Has been for me too. Starting to track my blood sugar has been very, very eye-opening.
Oh, yes, it's fascinating.
It is. Yeah.
Yeah.
I've shared that like on this podcast already many times, but I don't think we have talked about it, that I actually got rid of my period pains. I had terrible pains. And then I learned from, again, Nicole Jardim, that blood sugar can have something to do with it. So I started tracking it. And sure enough, there are some foods that spiked it up to like 160s and stayed there for a little while. And then
what foods did that for you? I'm curious.
Oats, sweet potato.
Interesting.
And now when I want to have these foods, I definitely have to always combine with protein and fat. But even then, the spike can sometimes be very noticeable. And then sugar. I do have big sweet tooth, and I have had to just like cut that back, because I used to have, chocolate, whatever, ice cream, whatever, I just had them. And then when I, saw what they actually did, and then for 1 month, I significantly decreased all that, and then constantly kept checking my blood sugar and figured out, okay, eggs are perfectly fine, avocados are good, like this amount of rice with chicken is fine, but a little bit more actually drives me a little bit crazy. I started kind of figuring out these things, and this was the first month when my period came with no pain. I was blown away. I was like, what is this thing? And then like the next 4 or 5 years the same way. So it's been just such a big thing I never truly thought about it. I was like, people talk about blood sugar and how they like crash. I never felt the crash. I never felt like super energized and then crash. I just did not feel this way, but something was still happening clearly. So that's
fascinating. Yeah, it's really interesting because everybody responds differently to different foods. So that's why it's really hard to tell people like specifically what to eat, because you can't know exactly how. Yeah.
Even if it's like a low glycemic index, it doesn't mean that it necessarily works.
Right, like sweet potato.
Yes.
Yeah.
Really weird. So
it's so interesting.
Useful tool for sure.
Yeah. What do you think though about people with history of disordered eating doing blood sugar tracking? Because that can get kind of tricky.
It can, but it's doable. Like that's me. I have a person with a past with like disordered eating, and
me too.
Yeah, but I find that it's like if I do it for my health, and if I'm able to, first of all, I'm not a perfectionist anymore. So I let go of that old past, and now I'm just like, okay, let's like look at things like it's data. It's not like my worth or my value. It's data for me. So I'm gonna take this information and use that.
Right. And when the goal is really just feeling your best, it's not about having a perfect body. It's about how do I feel and what's going to allow me to show up in the world and as my best self.
Yeah, absolutely. And then I feel like the same thing can be done with macro tracking. You mentioned that also earlier. I don't know, do you use macro tracking with your clients?
Only for protein.
Only for protein.
I will give them kind of a target for protein often, just so they can actually gauge like how much protein I'm talking about. Because if I just say eat more protein, they're like, oh, okay, I'll have 2 eggs.
Yes.
I'm like, no, that's not enough.
Yeah.
So I'll give them a target for protein, but usually not with I don't give them like numbers of grams to target for the other food groups, but I'll tell them more like, give them an idea of what I mean, like eat an entire sweet potato, not just, if someone's trying to get her period back and she's used to eating half the sweet potato, I'm going to tell her to eat the whole sweet potato.
Yeah. And that too can be used as a tool, tool to improve your health. And I don't care if even somebody uses to improve their body composition, as long as they don't go crazy with it, why not? I don't see that it's a crime or anything.
No, I'm not against it at all. I think just for when there's when it becomes overly obsessive, like you have to track every single thing every single day, and then you start eating the same thing over and over again because you know exactly how it's going to fit your macros, then it's kind of like, may not be serving you anymore.
Yeah. But if it's done in a healthy way, why not?
Yeah.
Okay, so there's been a lot we have covered today. So it's been super fun. Is there anything that I didn't touch but you think would be really good to and important to add?
Well, let me see if... No, I think you asked some really great questions.
Yeah.
I just want to look at your list and see if there was anything else that we skipped. But no, I think you covered.
Yeah, I think
you covered everything.
Yeah. So how can people stay in touch with or get in touch with you?
Well, you can follow me on Instagram.
Yes, please do. Everybody, go now.
It's dr.elly Michelle, Elly Michelle, Michelle. And then you can also check out my website, which is drellymichelle.com. You can subscribe to my newsletter, which I recently started doing. It's called the Body Wisdom Newsletter. I have a lot of fun with that. So I don't know, that's a fun way to see, to get a different side of me that you don't really see on Instagram. And then, if you're interested in working with me, I have a form that you can fill out and you can apply to work with me. And that's accessible from my Instagram or my website.
Nice. Yes, I'll be sure to link to all these places in the show notes too, so people can find you.
Cool.
All right. Well, thank you so much, Dr. Elly, for this
conversation.
Thank you. That was great.
Thank you for having me.
Of course. And I'm sure that it was really, really useful for my listeners. So thanks again. Thanks so much for listening to the Balanced Vibes podcast. If you liked the episode, please subscribe and also leave a 5-star review on iTunes. For more about me, check out my website, urbanjane.co. Yes, that's CO and not com. And connect with me on Instagram, where my username is Kirsten Kimura. That's KERSTENKIMURA. Until next time.